Hello everyone, this is Professor HemePath. Today we are going to talk about PT or prothrombin time. Kumar, what do you understand by PT?
Yes, sir. PT includes physical training, short form for personal training in gym, and you know PT Usha?
It's okay. Let us see about prothrombin time, which is one of the most commonly used clotting factor assessment along with APTT, which is activated partial thromboplastin time. So before going into prothrombin time, let us see the clotting pathway, which is very important to understand how prothrombin time is measured. When we talk about the clotting pathway, we have the intrinsic pathway and the extrinsic pathway. The extrinsic pathway gets activated whenever there is tissue damage. When tissue damage occurs, tissue factor is exposed, which combines with factor 7 to activate it to factor 7A. This complex activates factor 10 to 10A in presence of calcium and phospholipid. Prothrombin, in the presence of factor 10A and calcium, phospholipid and 5A, it gets converted into most important thrombin. Now this thrombin converts fibrinogen to fibrin and factor 13 to stabilized factor 13, that leads to formation of a stabilized fibrin clot. So this is the extrinsic pathway we are talking about. Now intrinsic pathway, which I'll show you in a separate video, it leads to formation of 9A and 8A, which further activates and forms factor 10A. Now, as both the intrinsic pathway and the extrinsic pathway converge on this point, this is called as the common pathway. This is called as the common pathway. Now, when we talk about extrinsic pathway as a whole, extrinsic pathway includes the extrinsic pathway proper along with the common pathway assessment, and this is measured by the prothrombin time, which is PT. Now when we talk about APTT, we measure the intrinsic pathway and the common pathway with APTT. Let us focus on prothrombin time. Prothrombin time is the clotting time to assess the extrinsic pathway. Now what are the factors that we are assessing when we are testing the prothrombin time? The factors we are assessing are factor 7, factor 10, factor 2, fibrinogen. Now these three factors are factors of the common pathway, and this is exclusively for extrinsic pathway. So it depends upon the factor levels of 5, 7, 10, prothrombin and fibrinogen. 7 is highlighted separately because it is exclusive for the extrinsic pathway, whereas 5, 10, prothrombin and fibrinogen are also part of the common pathway. So whenever we test the prothrombin time, we are testing 7 along with these factors of the common pathway. Let us see the testing procedure. So to the platelet poor plasma, we are going to add thromboplastin. Now thromboplastin is the source of tissue factor and phospholipid. You add this weight and add calcium to it, and you measure the time to clot. The clotted plasma is the end point of measurement. So why are we adding thromboplastin? Thromboplastin contains tissue factor, which is necessary to activate factor 7 to 7A. It also contains calcium and phospholipids, so that they are needed for at these time points. So thromboplastin is exclusively needed for the reaction to occur. The normal prothrombin time is 12 to 15 seconds. It is not in minutes, it is 12 to 15 seconds. Kumar, can you say why it is in seconds, not in minutes?
Obviously, sir, if it is in minutes, we'll bleed to death. So it is in seconds.
Excellent. So if it is in minutes, obviously you don't want your clotting to be in minutes. It should be in seconds, so that your bleeding gets arrested very soon. Whenever it is in minutes, there is a clotting abnormality. Okay, so what are the times when there is increased prothrombin time? Oral anticoagulant therapy, which is vitamin K antagonists, liver disease, vitamin K deficiency, and DIC. These can cause increased prothrombin time. Now let us see how these are causing increased prothrombin time. Oral anticoagulants increase the prothrombin time by inhibiting the vitamin K dependent factors, which are 2, 7, 9 and 10. 7 is present in the extrinsic pathway, so it is inhibited. Liver disease, because liver is the source of production of all the clotting factors, so it can lead to increase in prothrombin time. Vitamin K deficiency, again vitamin K dependent factors 2, 7, 9, 10 are reduced, so PT will be prolonged. DIC is a consumption coagulopathy. It uses all the factors which are responsible for coagulation, so PT increases. Some of these also increase the APTT. I'll show you in the next video, but focus on PT. PT is increased by all these 4 conditions. We'll discuss about APTT in the next video. Thank you for your attention.